You are a go.
Thanks, Jim. All right. Good evening, everybody. Happy Easter. Happy Passover, everybody. This is the sixth of these Attleboro area. Steve and I, we have Major General Keefe, the Adjutant General for the Massachusetts National Guard. The mayor may join us. We have State Senator Paul Feeney, State Rep Jim Hawkins, Attleboro Public School Superintendent Dave Sawyer, and Attleboro Chief of Police Kyle Hegney. Thanks so much, everybody, for joining us.
Thanks, Tim.
And we'll start off first with General Keefe. So first and foremost, thank you so much for joining us. I appreciate it. And thank you so much for the work everybody in the Mass National Guard is doing out there. Definitely appreciate it. Can you start off by talking about what the Guard's mission is here in Massachusetts?
Sure, Tim, and thanks for having me. And thanks for being part of our team for so many years and being part of the nation's first. So I want to thank you for your time in uniform. So really, what our mission is, overall mission is, anytime we're activated, our mission is to preserve life and protect property. And as it applies to COVID-19, we have a wide variety of mission sets we're working. Logistics, we've been moving PPE all over the Commonwealth with our forces. Medical, we've got about 110 soldiers and airmen right now in the Holyoke Soldiers Home, trying to help with that mission, working 3 shifts a day there. We've got a law enforcement mission. We've got our military police and our security forces on the Air National Guard side. What a lot of people don't understand aren't aware of is anytime we activate our military policemen and our security forces on the Air National Guard side, we put them on state active duty. They have the same law enforcement authority equal to a state trooper. So they can go ahead and be embedded in any municipal police department or the state police across the Commonwealth. Right now, we've got folks working in Boston on law enforcement, out on Nantucket, Springfield, and we're looking at a couple other areas as law enforcement officials end up going down because of the COVID virus. We've been backfilling those slots there. We also one of the biggest things we've got going on right now is COVID test taking. We've completed 92 missions, and we've tested over 3,500 at-risk folks from within the nursing homes and assisted living centers across the Commonwealth of Massachusetts. So right now we've got about a little over 1,300 folks on Title 32, which means the feds are paying for the folks that work here for the governor, my soldiers and airmen for the governor. So we're a little over 1,300. The governor originally gave me the authority to go up to 2,000. We'll probably hit that this week. He just issued another order giving me the authority to go up to 5,000, and we'll see what happens over the next 2 weeks if we come close to that mark at all. But those are some of the missions we're doing. In addition to, we also, as you know, we have a decontamination capability with our subburning unit as well.
Excellent. And that leads to one of my next questions was, based on a number of different models online, it looks like the peak is either here or coming over the next week or so. Does that change anything? How is that affecting your mission?
What it'll do for us is it'll put a bigger demand on what we're doing. We'll be moving more PPE across the Commonwealth. We're expecting to kind of receive some more shipments throughout the week, and we'll move those to the 2 warehouses we have. But then we've been bringing them out to the hospitals, to law enforcement, to firefighters, just getting them out. We're also looking at potentially working with Executive Office of Public Safety and Security to maybe stand up some more drive-through test taking facilities as well. Right now, we're manning the one in Foxborough, and we are also manning the drive-through first responder one in the Springfield area as well. So we'll probably pick up that a little bit more. I can tell you our medical folks will definitely be tasked. What we did is we pulled all the medical folks out of the units. So the med techs on the Army units, as well as the med techs out of the air units, nurses, physicians, assistants, doctors, we pulled them all into, and we created what was called Task Force Medical. And that allows us to basically just deploy as a force provider any medical capability we need to out in the area. And then what we did is we took our infantry units and our infantry soldiers. And folks always say infantry soldiers can do anything. I know as an artillery guy, you probably don't agree with that, but we've trained them to be the test takers. So they're part of the teams that go around with one medical technician who's the technical expert, and they're the ones that have been conducting all the COVID testing for the nursing homes and that at-risk population out there. I see those areas really starting to expand, and I see law enforcement will continue to expand as well. As more and more of our first responders come in contact with positive folks, they're going to get sick. They don't want to go home and kind of infect their family, so they're being put in some other areas. And we've created down in, I know you spent plenty of time down at Camp Edwards. We've created a Mass National Guard, kind of a COVID positive holding facility for our folks there. We don't want them going home and infecting their families, so we hold them there till they're healthy, and we can kind of get them back to work.
How many soldiers have tested positive so far? Is that something you can share? Or?
Yeah, we haven't had a lot. I think we've had approximately 12, which is not a bad number. Well, yeah, about 12 have gotten it so far, and they're that younger population, so we're pretty optimistic they'll be getting through it. That's interesting. You talk to them, it's not the upper respiratory thing with these younger kids. It is the aches, the body aches are just unbelievable, is what I'm hearing talking to these guys.
Interesting. And so you mentioned briefly a hospital down at Joint Base Cape Cod, JVCC in Springfield, and working in Foxborough. Are there other medical facilities that you guys are you standing those up, or what are those different facilities?
So in Foxborough right now and in Springfield, you have what's called it's a drive-through first responder COVID testing capability. But then the state is actually, in accordance with FEMA, with the military, and with the State Health and Human Service Office taking the lead on it, the state has set up what we call auxiliary hospitals. And there's one down in Boston at the Boston Convention Event Center, BCEC. There is going to be one on Joint Base Cape Cod, Camp Edwards at the gym. We turned the gym into one. There's one that sounds like it's going to go into Lowell. Lowell is looking at one as well. And Springfield did have one that was being planned, but the mayor of Springfield and the folks out there took a look at their population, their available beds between Bay State Medical and Mercy Medical, and they basically came back and said, hey, they didn't have a need for the one they're going to put in the Mass Mutual Center. So right now, those are the ones that the state is looking at for auxiliary hospitals.
Excellent. So while I was over in Afghanistan with the 26 MEB is when the SurfP was first stood up in Massachusetts, I believe, in 2011.
Right.
This mission very much feels like it's exactly why the SurfP was created. Can you talk a little bit about what the SurfP is? And
sure.
Yeah.
Yeah, it is so what the SurfP, as you know, it's a FEMA 1 resource. Falls under the Homeland Response Force. Massachusetts has a Homeland Response Force. Every FEMA region has a Homeland Response Force that is made up of guardsmen, military personnel that serve in the National Guard. Within that Homeland Response Force, we had what was called the SurfP, and the C in SurfP, CERFP. The C stands for, as you know, chemical, biological, radiological, nuclear, explosive, right? So anything bad from radiological to chemical to biological, like we're dealing with here. And then it's SurfP, Sovereignty Response Equipment Force Package. So it's a team made up of medical personnel, as you know, engineers, military. We got a little bit of military police in there. So for this one, you're right. This is right in their mission set. It's a biological threat. So they have the testing team that they have that is part of that. Goes in that medical portion. What we did with them is we kind of pulled them out because they're the experts, as you know, on wearing the full PPE. So they're the ones now that actually, they're the guys that are leading these test taking teams that are going into nursing homes and everything else. So as we take 4 infantrymen, we marry them up with a member of the SurfP team, that expert that knows how to wear the PPE, how to make sure it's sealed properly so we don't lose those guys. And then we have a med tech part of the team as well that teaches these teams on how to properly conduct the test. And it's a nasal swab that goes up to the nasal package. They swab the nasal cavity, they box it up, and they ship it right off to be analyzed. They're pretty good on the fact that the test results have been coming back usually within 2 days. But we could not do this without this SurfP. Those experts, as you know, they've been trained to do this forever. And this is the B in the SurfP portion that is actually kind of proven their worth. We took the engineers, as the engineers, they're great on rubble removal. And in case you get into a disaster or a building collapses, we've actually moved the engineers to another mission set. Some of those engineers right now, we train to be almost like young med techs or young CNAs, and they're working in the Holyoke Soldiers Home right now with the 182nd Area Support Medical Company. And they're doing everything from just helping patients to get up, move them around, feed them, and then our nurses and the rest of the medical folks that are seeing to their needs.
Outstanding, sir. I definitely appreciate it. Do you have anything else you want to share with the public, or that the public should know? Are the soldiers getting the support they need? The soldiers' families, all of that. Do you have anything else to share?
We Massachusetts has always been great to us Guardsmen, as you know. So we're great. We're in great shape. The only thing we would share is, everyone's in this thing together, and all in all, Massachusetts, I think, is really doing a good job. And the governor put out the advisory. People are doing a pretty good job staying inside. And we're all New Englanders, right? We're a hardy stock. And plus, we got a little bit of Massachusetts attitude about us. Usually, nobody tells us what to do. But the Commonwealth is really doing a great job listening to the governor. What I would just say is, if you're able, volunteer. They're looking for volunteers. And if you can't volunteer, just check on that neighbor who might be too old to kind of get to the grocery store, or, maybe is a single parent with 4 kids and can't figure it out. That's what I would actually say is we got to take care of each other through this thing. But for those of us in uniform, we're always well taken care of by the citizens of Massachusetts. And like we always say, and when you were in uniform, what I like to say is when the guard shows up in your neighborhood, things are going to get better, and they do. And as you see, we're all over the state. We have, like I said, we've conducted over 600 and something missions already, and we're looking to do it for the next 3 weeks till we get out of this. So we're good. And like I said, I just want to thank you for the opportunity. Once again, thank you for your time serving.
Thank you, sir. I do have one more question. It's the most
Sure.
important question. You talked about Air Force medical and Army medical. Which one's better?
I'm in a tough spot. I'm one of those Air Force officers who one of his child that went into the military went Army, and she is an Army nurse, first lieutenant, and she works the 3rd shift at the Holyoke Soldiers Home right now. So I gotta say my loyalty is certainly to the Air Force, because they've taken care of me for 34 years. But my future, I don't know. I gotta say the Army's mostly running the show because of numbers. I'll leave it that. In the Mass Guard, the Army Medical is running it, and the Air Force is certainly, Air Guard's happy to be part of a joint team. I guess that's a politically correct answer.
I get it. It's classified, right?
Yeah.
Hey, thank you so much, sir. I appreciate you joining. I appreciate the work that everybody in the Mass Guard is doing out there. I understand that you're incredibly busy, so if you want to jump off, absolutely feel free.
Okay.
Thank you so much.
No, Tim, thank you. Thanks again. I want to thank the citizens of Attleboro. You guys have always been great to us. So thanks, and everybody stay healthy. Thank you.
Thank you, sir. All right. Next up, we have Senator Feeney. I always make it difficult for you.
Now I got to follow the general. Is getting increasingly more difficult.
You're welcome.
Again, for doing this, it's a great service. Happy Easter, happy Passover to all those that celebrate. Certainly one for the record. Everybody, it's an interesting time. First, you take it, really just put our hearts and minds together and pray for everybody that's dealing with difficulties and challenges, and know that we'll get through this as we have before. Our strength as a community is to be able to persist through adversity. We've done that before, and I've seen so many people step up from Attleboro over the last few weeks, the last month, and I know that's going to continue, Todd. So I appreciate everything that you and the folks in Attleboro are doing. I just want to give kind of a quick update. I know we got the chief on here and others we want to hear from. We are in the midst of what by all accounts looks to be the surge. The models and projections show that the next 10 days, we're probably going to hit the peak somewhere in the Commonwealth of Massachusetts. Who knows? I mean, models are just that, they're models. but all the data is showing that certainly the loss of life is increasing, the amount of infected individuals is increasing on a daily basis, and we're really kind of coming to that period that's just so critical in this public health crisis. So I want to urge everybody. I know it's difficult. We've been through a lot over the last month. Please continue to do what you're doing. To borrow, a couple of lines from what the general just said, this is our mission as civilians. This is what we can do to help each other out. If it's not for you, then it's for the next person. It's for the next woman. It's for the next man. It's for your neighbors and your family members. So as civilians, this is our mission. We have to continue to do this over the next couple of weeks. Please, please, please stick it out and stay home. With that surge that's coming, we're paying very particular attention to resources in our hospitals and healthcare facilities across the state. Myself, Representative Hawkins, Senator Roush, Representative Poirier, we're on a call with Sturdy Memorial at the end of last week to get their sense of how well they're prepared for the surge, to get a sense of resources, ICU capacity, ventilator capacity, and certainly PPE capacity to keep not only the patients safe, but the nurses and physicians, the respiratory therapists, and really everybody else that's working on the front lines in the hospital. Left that meeting, honestly, very impressed with what Sturdy is doing as far as making sure that they have the capacity for what's about to come and what's happening. So far across the state, we've been able to keep up with that demand, and Sturdy has as well. We had a briefing. I was on a briefing on Friday afternoon to get an in-depth kind of understanding of what the surge plan is for the entire Commonwealth. And I'll say that so far we've been able to keep up with the demand. However, the next couple of weeks is going to be difficult. We know that there are pockets across the Commonwealth that are going to reach a point where the demand far exceeds the capacity in certain healthcare facilities. So the idea now is to triage where that happens and to make sure that if there are hotspots, if there are pockets of the Commonwealth and of people, that are admitted to the hospital, folks that are admitted to ICU, and then, down the line as people move on to different therapies, especially ventilators, that we have to be cognizant of the fact that we may need to, move some resources around. As the general said, a lot of his folks are standing up additional healthcare facilities across the Commonwealth. I will say to the people in Attleboro that our legislative delegation has been very active in trying to ensure that we have such a facility down in this area. We've seen it Boston-centric. We've seen it, we just heard that there's probably going to be one up in Merrimack Valley, one down the Cape, down the Cape. We want to make sure that this area has a necessary capacity if it's needed. So those discussions are ongoing with DPH, with the command center, with the governor and his administration, who have been great allies for us so far. So that is happening, and I just want people to be aware of that. PPE remains a main priority. There's not a day that goes by that we're not dealing with the PPE issues in our healthcare facilities, making sure that the police chief and his folks have the PPE necessary, that the fire chief has their PPE, and it has been very difficult, if not impossible, in many cases, to make sure that they have the necessary PPE to keep their folks protected. So that's an ongoing issue, not only across the state, but across the country, as we know. But we're continuing to source from different areas and just try kind of on an ad hoc basis, really, to find as much PPE as we possibly can for everybody involved. Just want to finish, as I have the last few weeks that we've been doing this, Todd, on kind of the next piece of this. So obviously our focus now more than ever is on the public health crisis and dealing with the surge and surge capacity. But in addition, we know that the mitigation that we've had to come up with over the last month is resulting in what looks to be a major economic downturn. We saw projections last week that within the next 2 months, Massachusetts could hit 25% unemployment, which, to put it into perspective and for reference, we haven't seen numbers like that since the Great Depression. Even in 2008, 2009, we didn't even come close to the projections that we're seeing now. That's alarming. So there's a lot that we're starting to think about there, about how we reinvest in the economy, certainly how we take care of individuals. The legislature last week, both in the House and the Senate, passed a bill for housing evictions, to basically pause any eviction for folks that wouldn't be able to pay their rent because of the COVID-19 pandemic. Foreclosures, we hit pause on any foreclosures. And then there was a piece of that bill that was passed, or I'm sorry, that's in negotiations now, that talks about mortgage forbearance as well. And these are bills that you typically see at the doorstep of a recession or as you get further into it.
Real quick, what does forbearance mean?
So essentially, mortgage forbearance would say, it's a deferral so that the lender would be able to, say for a period of 3 months or 4 months or potentially even longer. If you cannot pay your mortgage, you're not going to be thrown out of your house. It's simply deferred and tacked on to the end of your mortgage. So the details are still being worked out on that. The Senate passed a version, the House passed a version, and I know that the conferees, so they put a conference together to kind of negotiate the differences in those two bills. The conferees met through the weekend, and we hope to early this week have a comprehensive housing bill. And one of the things that I've been getting questions on as well, how do you protect landlords if people can't pay their rent and they can't be evicted? How do you protect the landlords? Mortgage forbearance obviously is a big piece of that. The details are still being worked out, but the key to this, Todd, and what we've been telling people is we are in a crisis where it's important for people to stay home. So we can't have a situation where we're taking people out of their homes because they lost their job, they're unable to pay their bills. So the idea is, do what we have to do, make sure everybody can stay in their homes, and then have a process where once we come back up online and people can start paying their bills, we'll work through that. So hopefully we have a bill to the governor this week. Also last week, final piece I want to talk about, I want to thank Superintendent Sawyer and the school committee and educators and parents that have been reaching out in recent weeks. We know that the lives of teachers and of school administrators and parents have been completely turned upside down, as well as the students. And we're starting to, and I think Attleboro was really ahead of the curve on this, to make sure that we were keeping students engaged in a remote learning environment. And to be honest with you, we spoke about this a couple of weeks ago. There was no playbook for this. I mean, this wasn't something that we knew was coming months down the road. So when it happened quickly. And everybody had to come together and figure out what a remote learning environment looked like and how we were going to keep students engaged while they were learning remotely. Attleboro, like I said earlier, has really been ahead of the curve on this from a lot of different school systems that I've spoken to across the state. I'm really happy and proud with what my district has done. Dr. Baeta up in Norton has been doing an incredible job as well, and really just across the Commonwealth. But last week, we finally got to a point where we passed a bill and the governor signed it to waive the MCAS requirement for this year. The worst thing I think in the world we could have done is to say to school systems and to parents and to educators that, yeah, we know you're going through this, but now we're going to have to worry about taking a high stakes standardized test. I mean, that is just makes no sense to a lot of us. Certainly Representative Hawkins took the lead on this as well, being a former teacher himself. And we just wanted to make sure that we got that bill passed so that people could stop worrying about it. So the governor signed it. MCAS is waived for the entire 2019-2020 school year. And I believe the Commissioner of Education is starting to issue some guidance to our school systems as far as competency requirements and things like that. But I bring that up because I just want to thank so many of the parents and teachers that reached out to me, and I know Rep. Hawkins as well, over the last few weeks to advocate for that. It made a difference. We got the bill done, and now we're moving on. And then finally, I will just say that, we're paying particular attention over the next couple of weeks, like I said, to healthcare facilities across the state, but especially those congregate care facilities, facilities within DDS, developmental services, places like nursing homes, where it's become very, very difficult, where you have a non-ambulatory population, or maybe a population that doesn't understand social distancing and still wants to give you hugs, and very, very difficult to segregate, portions of those populations that may be infected. We've seen what happened out the Soldiers' Home. We want to thank the general and his men and women that responded to that so quickly. And we want to make sure that that doesn't happen in other places across the state, private nursing homes, public DDS facilities, and places like that. So we're paying close attention to that. trying to figure out if there is some sort of step down facilities, places where we can move patients. I know that is not ideal, and we don't want to get into a situation where we have to do that. But as you know, being a military guy yourself, Todd, you have to plan for these things. Hope that it never comes to fruition, but you need a plan to do that. So those are some of the things we're working on. Unemployment remains an issue. I can't go 10 minutes without getting an email or a phone call with somebody trying to reach out and get on unemployment. The Federal CARES Act that was passed that we talked about last week, the state finally signed their agreement with the federal government, which means that that extra $600 kicker for anybody that's either currently receiving benefits or that may apply for benefits in the coming weeks, you'll get an extra $600 on top of your normal unemployment check. So that is going to happen this week. That is signed, sealed, and delivered. You will be getting that in your check if you apply for unemployment. The second piece of that we always get questions on, what about the folks that are self-employed, gig workers, 1099 employees? That's taken a little bit longer than I certainly would like to see. The federal government guaranteed it, so those people will be able to collect unemployment. The problem is it's a brand new pool of applicants that normally aren't in the traditional unemployment insurance pool. So what we need to do is stand up a system. You have to stand up a platform that would probably, in a bureaucracy, take a year or two to stand up. We have to stand it up within weeks. The governor told us or announced last week publicly, and the administration told us that they're working for an end of the month deadline on that. There's a lot of us in the legislative delegation that are pushing them to get it done quicker because people need to get benefits as quickly as possible. So those are some of the things we're hearing and working on. Certainly, if anybody wants to reach out, I say it all the time, call my office at 617-722-1222, 722-1222. My staff is working remotely, but we swap the phone around and one of us will pick up, any day of the week. Also, send me an email, paul.feeney@masenate.gov, paul.feeney@masenate.gov, and we'll get back to you, as quickly as possible. If it's an urgent nature, just let us know, and we'll call you right back. So thanks, Todd, again for doing this. Thank you, Steve, and thank you for everybody involved for what you're doing. Attleboro is a proud community that's just doing incredible work through this very difficult time. So happy Easter, happy Passover, and we'll get through this soon, everybody. Thank you.
Thank you, Senator Feeney, for everything you do. Would you say you're still just as busy as ever?
I will say, Jim Hawkins and I spoke the other day, I have never been this busy in my life. It's very difficult to find the time to get everything done in the day, but it's challenging. But when you get the calls and the emails that we do, Todd, it just, it reinforces why some of us get into public service and do the things that we do, because people are looking for help. They're looking for some sort of, beacon of light, not to be cheesy about it, but there's a lot of uncertainty, and if people reach out to us and we can help them, there's no more powerful thing in the world, and it's the best job in the world. So I'm appreciative of everybody that's reached out with some moral support. But we're getting there, and we're just trying to help as many people as possible.
Thank you so much. Representative Hawkins, how are you? Jim?
You're on mute, Jim.
Okay, now I can talk.
There you go.
I do that wrong every week. And one thing I do say every week, and I know Todd and you, Senator Feeney, and Steve have heard this a few times. I got to compliment Todd, because this is public, so some people may be listening to this for the first time. Paul, you and I get, Senator Feeney, you and I get the regular updates on COVID-19, have for months. And there's one person in this city that has asked me to forward them every time, and that's Todd Kobus. Going back a couple months before anybody else was interested, he was on it. And we share with each other in the House, and you do with the Senate too, different stories about what's going on in our communities. And some people are saying, "Oh, we just had this video conference with the city." Well, hello, we're on, is it our fifth or our sixth one? It's a weekly thing on AACS. Thank you, Jim Jones, for people to watch. And the one thing we've been told is the most important we can do as elected officials across the board is to communicate with the public. Good news or bad news, they need to know that we're there and doing things. And Todd, you've made that happen in Attleboro. So congratulations to you.
Thank you, Jim. It's a team effort, and Jim Jones and AACS do all the heavy lifting.
Yeah, but it's your idea. And you organize the speakers and the agenda every week, so take credit. You had asked me about Senator Warren's office. I think she can be on, not her, but somebody from her office can be on next week, probably to talk about the CARES Act. It's not, the details aren't worked out yet. They've got to invent all the software and everything, so it's a little premature, but I'm hoping we can get somebody on here from them next week to talk about that. I think what Senator Feeney said about the constituent request, particularly unemployment, I'm very fortunate in that my legislative director, Tara Major, is very organized and very efficient. It's a system that I think there's good news coming. It's going to get better. Some of the registry workers that were laid off are now being transferred to unemployment, getting trained to take those calls. By good news, that was the department that was put on the cloud a long time ago, so they're not likely that the computer system will crash despite the heavy load. I think that's a system that's working pretty well, but we certainly I get calls and people, can you help me? Well, yes, actually we can. So that's a good thing. Some of the work we've done has been a little difficult because we're not in the State House. Dave Sawyer and Steve Withers have gotten crazy texts from me. This is what's happening with the MCAS bill. And as it moved through, and I think in normal times that could have happened a lot easier, but everybody's working from their dining room table trying to do this work. In the end, it worked out. They made the right choice. We passed the right legislation, but it was challenging to see that happen. Senator Feeney also mentioned the work that's happening in the State House on housing. It's a tricky bill because if you can't pay your rent in April, so we put it off till May. Well, if you couldn't pay one in May, you can't pay two in May. You couldn't pay one in April, you can't pay two in May. And the landlords oftentimes they're relying on that rent for their own income if it's a 2-family or 3-family and they're living there. So the bill is tricky to have this come out right, but we're working on that. I made notes. The biggest thing that I'd like to talk about is Stronger for Attleboro. The Attleboro Interfaith Collaborative and Robin at the YMCA have put together a new program as a fundraiser because a lot of the people, the organizations in the city that are particularly providing food, Attleboro Interfaith Collaborative, Food and Friends, Hebron Food Pantry, the food pantries in Murray Church and St. John's and St. Teresa's. There's a whole lot of nonprofits that are not able to have their fundraisers this year. I know Hebron had to cancel their fundraiser. In Boston, the Greater Boston Food Bank canceled their Hunger Walk, which makes $2 million a year. So particularly local, to look out for the local people in the Attleboro area, they've designed this new fund, which local nonprofits can apply to. And they're also looking, of course, on the other side for donations. It's called Stronger Together Attleboro. So the website is StrongerTogetherAttleboro.org. The email address is StrongerTogetherAttleboro@gmail.com. And I believe that's the name on their Facebook page also. So there's a bunch of ways. This has all become public in probably the last 24 hours. And I think I'd like to have some graphics to share you. I don't quite have that yet, but please look for it. We're incredibly fortunate. I know, Todd, I've seen you at the food pantry and at one of the soup kitchens. These volunteers have kept this going, even though they're probably getting, 50%, 100% more people needing their services. And they used to do it indoors, and now they got to figure out a way to do it as a drive up or a walk up. They've done incredible work, but we do need to support them. So I would urge everybody to look for that and support that new fundraising mission. Thank you.
Perfect. Thank you, Representative Hawkins. It will share that once we have those graphics and whatnot. I'm sure we can get that shared out.
I'm gonna look to you for that. I probably have it, but I don't know how to get it on here. So next week we can share it.
Perfect. Love it. Next up, Superintendent Sawyer and Steve Withers for the Attleboro Public Schools.
Good evening.
Good
Hi,
evening.
Todd. Thank you.
Thank you, Superintendent Sawyer, for joining us. I think everyone in this group and in the public is probably tired of hearing from me about the school. So having another voice kind of fill them in on what's going on is helpful. And we were just hoping you could kind of fill everyone in on a status update of what's going on, specifically with the remote learning that started, April vacation, what MCAS and end of school looks like at this point, and whatever else you think is important.
Thank you, Chairman Withers. Yeah, I'll start rambling, and if I forget a topic, please stop me and redirect me. First, I would like to thank Senator Feeney and Representative Hawkins for their hard work to do the right thing and suspend MCAS for this school year. Honestly, I don't know how the state would have conducted the testing if we hadn't done that. I don't think people understand how MCAS requires 2 full months of complete commitment and effort by schools to pull that off. And basically, when we didn't begin that process at the end of March, I don't know how we were going to pull that off. So it's a great relief for the administration, I'm here to report, but as they talked about, much more importantly, a relief to students and families, that on top of all of our other worries, we don't have to be worrying about the consequences of a high stakes test. So very excited about that. And there are some more details come out as it relates to competency determination, which is, what you need to earn in Massachusetts to be eligible for a diploma. So that's really a high school issue, and in this moment affects very, very few people, but we look forward to hearing from Desi about more of that. April break, we really appreciated the school committee's support of the administration's request to alter the school calendar. And then after you guys took your vote, we worked with the union to work out the details of how that would work. And so as a result, by moving 2 days from June into April break, we are going to be able to continue what we're doing through April break, which is offer a week worth of learning experiences for students during that week. Now, as you can tell by what I just described, there's only 2 work days to do that. So it's a little bit of a different week for teachers and administrators to pull that off in 2 days. But for the families, it should be pretty comparable to what they've been experiencing. There'll be a plan, it'll be a week's worth of work. There'll be very clear times that teachers are available, both to work with students and to interact with families and communicate on whatever needs that they can support families with. And so that's no different by putting the focus of that week for teachers on supporting students and families, and less on the kinds of work we've been doing behind the scenes to make all of this work, meeting with each other, meeting with us. Those are the things that we gave up that week so that we could deliver a week's worth of instruction in only 2 days. We gave up all the planning behind, and as I'm sure you can appreciate, the planning still has to continue. So that means that some people are going to have to do some of that ahead of time or in the margins. So we really appreciate that the teachers were willing to make the sacrifices necessary to make that all work. And they were willing and eager. And so we're very excited to be able to do that. So we thought it was important to have, another week during April break, a week of learning, because we're just getting going. We're building some momentum based on the systems that we've put in place. And I should probably pause here to just talk about how, remote learning is, it's kind of a very nice term to capture the fact that, we don't have any sort of playbook, as has been mentioned before, on how to accomplish this. We're not set up to do this. And quite frankly, none of us believe that we can really deliver the same quality of education under these conditions as we can normally. That being said, though, we're dealing with the situation that we're dealing with, and we got to make it work. So, we've altered our priorities. We put much more emphasis on engagement. We want to make sure that we're reaching all of our families, that we know that they're participating, that we haven't lost anybody, and that we're focusing on the social emotional needs of students, right? Being at home for this long of a period, not having access to peers, humans are social animals. We really like to be around other people. And the two kids I have at home are, they're embarrassed to say how much they miss school, because they never realized how important it was to them to have the opportunity to be around their friends, even if it meant they had to put up with the educational environment. So we need to try to help with that. And that's been a much bigger focus for us. Now, that being said, considering how long we're out for, we got to worry about some learning too. We don't want to suffer any regression. We know that students regress over the summer if it's a long break. And, this break is comparable to that already. So, we really want to make sure that we shore up what we've been teaching kids and give them a chance to practice and just put themselves into a learning mode during the week, and if nothing else, help provide some structure to families. I know in my family and many of the families that I've talked to, the context that we're operating at home is very, very, very difficult, right? So everybody's trapped at home. Nobody can go out and socialize with other people. Many of us have stresses on us, the strain of being home with the kids for that long and making sure that all their needs are attended to and helping them to stay, productively focused on whatever you need them to. Plus, you've got to do your job. I can't say enough for our teachers in the Attleboro Public Schools. I mean, they haven't complained at all. They have really dug in and are doing their best, even though many of them are at home, doing work from home that they're not trained or really supported to do. They're doing that while they're also caring for their own families at the same time in many cases, and dealing with all the worries of what's going on around us. Many of us have parents that were concerned about their health and safety and wanted picking up the groceries for them and all those kinds of tasks. So the fact that our teachers are doing all of that and finding a way to make this all work is really, really I think laudable, and I know that I speak for many when I say how much I appreciate the fact that they're just doing it, because I know in some communities it's not they're not as lucky as we are.
Superintendent Sawyer, just
Yeah.
on that, before you go to another topic, have you had a chance at all to look into it and determine how much engagement and participation there is among students? And obviously, I shouldn't say obviously, but probably not every student or family is able to or is taking part, but have you been able to determine how high the participation is?
So, the answer is that it really, really varies. The age of the student, and then, other factors play in. We have very few families that we haven't heard back from. So, that's where we're putting a lot of effort into, is to try to at least contact people, understand their context, and provide support, because our ELL population, because there's a language barrier, they were slow to understand what we were trying to do and understand all the resources that we're providing for them. And maybe understand is the right word. The message wasn't getting to them, right? So they're a little bit behind, but through hard work and effort of making contact, of getting getting them on the line and working through our communication problems, where we've drawn a lot of them in and gotten them the resources they need, including, we've handed out about 1,000 Chromebooks. We've helped families utilize the resources that companies are offering. All the cell phone carriers are basically offering free data through cell phones, turn your cell phone into a hotspot. And so, families that normally would have an access issue at home with the internet, we're able to help them work that out. So by working with families to understand what their issues are, we're getting to most right now. There are very few that are still unaccounted for, we'll say. Now, as for the ones that, we've contacted, there's a range. Some kids are not always participating in the activities that we're creating for them. And then, how do you judge participation? If I log in and mute my mic and turn off my video, but I'm there the whole time, is that participating? Well, that's certainly, you did more than the person who didn't even show up. But obviously, we're working on trying to get every kid to be an active participant, and, we work through it. It's, again, a lot of these things are particular to, context, right? Like 8th graders, in the last few months of their middle school experience are harder to convince double down on how important this all is as, say, third graders, right? I mean, third graders are excited and think it's neat to be talking to their teacher on a computer and are eager to do it. So, it's there's no one context, but many. So we're working through all of that.
And then has there been any, I know we've talked about it in the past, but not in a little while. Has there been any discussion with the state and DESE about, the May 4th date and whether or not that's still the plan or?
No, to be honest, zero communication. So we are simultaneously planning for a return on May 4th and planning for an extended closure. I think that, as our legislative delegates were talking about, the state's under great pressure to get us all back into the workforce and back to normalcy. But then, I'm sure many of us are reading what the experts are saying, and it seems like there's reason to believe that whatever normal is going to look like when this is all done, we're not going to get there until after there's a vaccine. So, given the roles that schools would play in a rebound outbreak of the virus, we would be, I think, a little bit naive to assume that we're definitely going to be back on May 4th. So we're just going to continue to prepare for both. And, I hope we go back on May 4th. I sincerely do. I know a lot of people feel that way, but we're going to be ready if we don't. And to be honest, I would imagine that if we're not going back on May 4th, there's not much, it's a pretty narrow window between that day and the day that we have to just call it on the whole school year. So we would have to wait to hear from DESE on how that would play out. And there's been no talk about that yet. The greater focus right now has really been about how to handle some of the implications of remote learning. So specifically grading is, I know, a topic that a lot of people have been concerned about. The high school did a lot of work on that this week. We're still working out some of the details about how we're going to handle credits and final grades. But considering we don't know whether we're going to come back or not, I think we have a little bit more time on that one. More importantly, we've made it very clear moving forward that the work that teachers are assigning remotely is work that we are going to assess. And so, sometimes we call that grading, right? So I assign you something, you do the work, you pass it in, and then I grade it, right? That kind of grading we are doing. If I ask you 10 questions and you answer them and you get 7 of them right, you got 7 out of 10. That was your performance on that task. What we're not doing is turning that into a grade. We're not saying, oh, well, you got 7 right. That's 70%. That's a C-. So we are avoiding worrying about final grades and turning performance into grades and really trying to focus on learning, which is much more about giving feedback to students about how their performance matches up to standards. And that is something that we're going to do during remote learning because that makes it more effective, right? If you do work and it just goes into a black hole, how do you learn whether you did it right or not, right? So we need to assess the work that we're assigning so the kids know whether or not they're doing it right or not. And some people call that gradings, and that's fine, but we're not going to turn that into some sort of average score because there are all kinds of problems with the implications of acting like we're going to, treat this work like we would what we were doing in school.
Then the last question that I have is if you've had any communications or looked into how what we're doing compares with other communities, both surrounding and like ours. I mean, this is a new scenario for us and for everyone. So just curious on how what we've done and how we've fared compares to everyone else.
Yeah. So, we do try to keep an eye on that. The Massachusetts Association of School Superintendents has been very helpful in providing information about how different communities are handling this, and through a listserv, people talk about this quite a bit. I think that what we're doing is in the meaty part of the curve of the range of things that you're seeing people do. Most communities in the Commonwealth are smaller than Attleboro, which means fewer schools. I mean, I think there are quite a few communities in which at any one grade level. There's only one school that houses that grade level. So, for Attleboro to have 2 levels where we have multiple schools means that we have a lot of practice coordinating our efforts. And a lot of districts, don't normally have to worry about that. So I would just say that I do think that what we're doing is a little bit more consistent on the whole. I think that what you'll see in a lot of our neighboring communities is more sort of, whatever teachers or buildings are doing, that's what's working for them. And, and here in Attleboro, we're trying to make sure that regardless of which school you go to, you're getting something comparable to the other schools in Attleboro.
Great, thank you.
Perfect.
I was just I know there's another concern out there about how this all relates to, moving on to the next grade. Obviously, this is an interruption in learning, and I think it would be disingenuous for me to sit here and say that our students are going to go as far this year as we normally experience. And I just wanted to reassure parents that there are going to be no negative implications for students on that, right? That'll be up for us to figure out, but students will continue to move on, and we'll work that out. And another thing I would say to parents, because I know there's a lot of anxiety about supporting their students through this time and helping them with their remote learning plans, and there's a lot of autonomy in implied in how we're doing this. All I would say is the parents need to do the best that they can and not worry about how we're going to judge it or whether it's good enough for us. Each family has to make a decision about what makes sense for them. And I know that we don't all have the same situations at home, the same capabilities, the same issues. So I know that some parents are calling us up and saying, that wasn't enough work for me this week. I need more, right? So we're working on doing a better job of providing enrichment on top of the minimum amount for the week. But then other families are calling up and saying, I'm completely overwhelmed by this. I don't know how to do this with my child. And for those parents, we say, okay, well, here, focus on this and start there and do what you can, because this is unprecedented, and we're all doing our best. And the teachers are trying, the administration's trying, the kids are trying. It's okay that the parents feel like they just give it their best, and it's going to be okay. We're going to work with people, and we'll all get through it, and we'll make sure that our students don't have don't pay a high price for this over the long run.
Outstanding. Thank you, Dave. Thank you, Steve. That was a great update. And thank you for everything you're doing. I'm sure you're just as busy as the rest of us. So thank you.
Appreciate it.
Next up, we have Chief Hegney, Attleboro Police Chief. Thank you for joining us.
Evening, Todd. How are you?
Outstanding. So how are things with the Attleboro Police in all of this? How are you guys faring?
We're doing good, to be as expected during this crisis. The men and women of the Attleboro Police Department are doing a fabulous job. I'm very proud of them. I'm proud of their dynamic and robust delivery of services in these changing times, daily, hourly sometimes. They're making adjustments. We're all learning. It's interesting, on a daily basis, we're being faced with different situations that we've never been faced with before. Also changing crime, calls of service, different crime trends during this period. So it's dynamic, but we're overcoming. They've definitely stepped up to the challenge. It's difficult being on the front lines because they're in harm's way. At the same time, they have families to take care of and loved ones and children, and it's a delicate balance trying to deal with both of it and stay mentally sharp and vigilant. So I commend them, and they're doing a fabulous job. But their training and experience has certainly shown that they are a very, very valuable asset for our city.
Excellent. Has anybody been infected yet on the police force?
We've had 4 officers in quarantine. We have 1 officer tested positive thus far. Knock on wood, that's as far as we go. I know the surge is coming. We're all worried about it, and we've put a lot of strong protocols and measures in place to reduce the amount of contact with the public on calls of service and access to the station, arrest procedures, transport procedures. So hopefully this is the only officer that will be infected. I spoke to him earlier today. He's doing well. His signs and symptoms were varied coming on to this and the onset of it. Even during his sickness, the last 2 weeks have been varied. Just seems like it affects each person differently and accordingly to their age also.
So I wasn't aware, General Keefe was mentioning that the National Guard has been supplementing some of the state police and local police forces. Have you considered that as an option if more people end up in quarantine or testing positive? Is that something we're considering here in Attleboro?
Not at this time. We don't have a need for it. We also have a strong mutual aid policy with our surrounding community. Also, we're a member of the Metrolec regional force that is basically from Milton down to Attleboro, and Attleboro out to Plymouth, and Plymouth back up to Milton. And there's, I believe, there's 67, 68 towns that are part of that consortium that could also lend resources if we need it. So we have concentric layers of support should we activate that. But right now, we're strong with the amount of manpower we have in Attleboro. If that changes and we have to have more officers that are quarantined, then we may have that. But if we have to call in the National Guard, we're going to be at a very difficult time within our police department then.
That makes sense. And you had mentioned some different types of crimes going on. Can you expand on that? Are there people trying to take advantage of the situation in different ways?
Yeah, there's always crime of opportunity, and there's plenty of opportunity at night now. As you can imagine, there's less people on the street, therefore there's less third-party policing, meaning citizens' eyes and ears out there. I would like to say that if you do see something, hear something, say something, call 911 and report it. Just don't assume that it's nothing, or you don't want to, or you're never bothering us. Please call us. We'll send a cruiser down to check it out. It could be nothing. It could be something. But if you see something, say something. There's not as many citizens out there traveling to and fro. The night workers aren't out there. The paper delivery people aren't out there. So those are the people we kind of rely on as third-party policing, and see something suspicious to call it in. The motor vehicle accidents are almost non-existent. As you can imagine, there's hardly any traffic on the street. The domestic violence has gone up approximately 46%. The noise complaints have gone up almost 200%. I imagine that a lot of people are at home, and now you have more contact in the densely populated areas of Attleboro, so it generates more noise complaints. Well-being checks obviously have gone up, and the new classification that we had to add to our CAD system, social distance violations. So we're the 6-foot police now. So people are calling up saying that, that person's in violation of the 6-foot rule. You got to go down there and separate them. And so it's been interesting, it's been challenging because during this COVID-19, we still don't lose our constitutional rights. We still have strong constitutional rights in this country that we still have to protect, defend, uphold, and honor. in order to do our jobs. It's been challenging, to say the least.
I can only imagine. Thank you so much for everything you're doing. Do you have anything you want to share with the public? Any suggestions or guidance to the public for how they can help you?
Be reasonable. We're trying just as they are. It's a learning experience for us also. I would appreciate if they watch their alcohol consumption. I know they're probably running out of movies to watch on Netflix. Alcohol simply adds to the problem, which we have been experiencing. The social distancing. I understand there's passive recreation usage throughout the city. That's fantastic. However, it's the full contact lacrosse games that we're trying to mitigate from happening and what have you. I think everybody is experiencing cabin fever at this point. The storm tomorrow is going to be interesting. It's supposed to get up to 65-mile-an-hour gust of wind. That's just another slap over our head that is going to add more demand of service upon us. It's going to be interesting on what happens. I hope it's minimal impact upon the city, but we can't really afford to lose power at this point. I mean, I don't know what would happen if people are now sheltering in place with no power. I think the domestics would simply go through the roof.
I'm glad you brought that up. So tomorrow from 2 p.m. to 8 p.m., we're expecting gusts of wind up to 50 miles an hour. Do you have any suggestions for the public for how to deal with that? Or if they do lose power, do they call 911 or do they call the electric company?
They shouldn't have to call 911. We're in constant contact with National Grid. We're on emergency services hotline with them. And we see the impact of the power outages. So they constantly send us notifications on how many customers throughout our city are out and regionally, geographically, where that's happening. Our biggest thing is to mitigate down wires, support the National Grid by asset protection or roadway closures and what have you. Obviously, if the wires do go down, they should not approach and then call 911, obviously. But if they just simply losing power and want to know when the power is coming back on, that's not the opportunity to call 911. National Grid has public information lines that they've been publishing now. The biggest thing they can do, if this storm is as bad as people are projecting, plan now. Plan now before it's too late. So whatever supplies and need-based items that you're going to have to get through a power outage, maybe for the 8, 9, 16 hours that may happen until National Grid can get out there and fix the affected areas, then plan now. Power outage is it's an inconvenience. It's not a life safety. We've become a society that depends on power usage, and when we lose power, it's like the sky is falling. That's become a constant problem. There was a time that we had a society without power, and we still got by somehow. We're seeing it compounding now that it's unless you're on a ventilator and need power, it's not a life safety issue. It's an inconvenience.
I don't know. When I lose internet, it's
Sound like my son.
Chief Agnew, do you have anything else to add? And thank you so much for everything you and the Attleboro Police are doing out there.
I just want to say thank you to the police union also. They've been fantastic. The mutual collaboration that we've come together and enjoyed throughout this COVID-19 response has been tremendous. And I just want to make I have a son who was in 8th grade, and he's doing this online learning for school and what have you. But it's ironic that for years I've been telling him to get off the Xbox and get outside. Now I'm telling him to get inside and get on the Xbox. It's like a role reversal now.
Oh, absolutely. Yeah, no, I think there's a lot of people in that boat. So that wraps it up. Does anybody have anything else they want to add?
But if I could, I just want to thank publicly and the men and women in his department. Like he said too, I mean, there's no playbook for this. This is a learning experience for everyone. Yet the opioid epidemic hasn't stopped. They're still reporting to drug calls. They're still reporting to domestic violence issues. And I just on that want to say, Chief Hegney and his department is not alone. Police departments throughout the Commonwealth have seen a huge increase in domestic calls, in domestic violence within the home. People are cooped up, stuck together. There's a lot of people are getting fueled up by alcohol, and we're starting to see that, unfortunately. Last week, the Lieutenant Governor announced a hotline for folks, and we just want to help try and amplify that. If you're shot or are watching us tonight, and you are in a situation where you are being abused, violence in the home, if you know somebody that is experiencing that right now, there's a 24/7 hotline. It's run by, we call it SafeLink on the Commonwealth of Massachusetts. That 24/7 hotline is 877-785-2020. So again, 877-785-2020. If you can get to us safe and call that. Certainly, if it's an emergency, call 911 and the chief and his department will respond. So please, if it's an emergency, call 911. But if you need to talk to somebody and try and get some help to get out of a situation that you're in or somebody that you know and love, 877-785-2020 or use 211, which has been advertised as the Commonwealth of Massachusetts COVID line 211, and they'll put you on with somebody from SafeLink to just kind of talk it out and see if we can get help. So it's a big issue. We've seen it across the state. We've seen it in this region. We've seen it in the city of Attleboro. But I just want people to know that there is a way out. There is somebody to talk to that can help you. And again, it's emergency 911. But other than that, 877-785-2020. Thank God.
Outstanding. Thank you, Paul. Anything else from anybody? All right. Happy Easter. Happy Passover, everybody. Thanks so much for joining us. Thanks, everybody that watched. And we'll see you next week.
Thank you, Todd. Thank you, everybody.